I found out I was pregnant very early on in the pandemic, a couple weeks into lockdown. And I think having two small children at the time and being pregnant with my third has really kind of colored my family's decision-making process. I'm advocating for two things. One, I would like the United States to align nationally under a clean indoor air legislation that focuses on infection control and adheres to ASHRAE 241, or hopefully even better. We also need to hold schools and their vendors accountable for achieving good, clean indoor air. And that means transparency. So right now, if you're a parent and you're trying to figure out, is the classroom that my kid is in safe? It's very difficult to do that in most places in the country. Even in schools with decent classroom ventilation, a lot of them have chosen not to or couldn't afford to deal with ventilation in larger shared spaces like the multi-purpose rooms, the cafeterias, the bathrooms, the libraries, the gyms. There's a lot of parents like me who also agree that there's an issue here. And so I've been talking to a lot of different parents about how we can align more formally to try to advocate for changes, both at a local level and also nationally as well. For every child and every teacher that's in a school, there's typically a family associated with them. Schools are one of the largest ways that COVID spreads. A lot of people don't want to believe that COVID could be the root cause of whatever other issues their kids are having, because we've been sort of coached into believing by public health that we're just going to have to live with it. Certainly in my own life, I've seen friends constantly complaining, I think we all have, about how their kids are always sick. The family is always sick. And it's not just winter anymore. When your immune system gets knocked by having one illness, then the next illness comes a lot more easily, especially after COVID. I think a lot of people felt sort of betrayed by public health and never really learned that even though cloth masks are not the best solution, there is a really great solution out there, which is, N95 and better respirators. And so this message has been lost on a lot of people, and it's been combined with a message that you'll be just fine getting this however many times a year, that the side effects are quite rare, when that's really not at all the case. The administrators are all trying to figure out how they can improve the absenteeism problem. Clean air is one way that we think can really help that. And if you can get your administrator on board to understanding the cleaner the air, the more mitigations that you have, the healthier the kids will be. The other thing is test scores. So we know that if kids are in dirty air, high CO2 levels, wildfire smoke, they're not going to be performing at their peak, nor will they be performing at their peak if they're ill. So if you're trying to boost test scores, clean air is a great way to frame the opportunity for improved test scores and improved attendance rates. We are living in a different world than we were living in 2019. And we really need to recognize that things are not the same as they were. And we have this health issue that is everywhere. And we should really focus on trying to reduce the impact that this health issue is having on people. And the way to do it is not to pretend that it doesn't exist or to wish it away, but to actually address it. And the number one way that's non-controversial that we have to make that a reality is cleaning the air.
No deben esperar tanto tiempo. La persistencia viral para nosotros es muy evidente. Si bien no es la única causa, pero estimamos que alrededor del 75% de los pacientes con COVID persistente o long COVID tiene persistencia viral. Con la evaluación clínica se puede hacer un diagnóstico de un síndrome de hipoperfusión, hipercoagulidad y microcoágulos, que de manera simplificada denominamos síndrome de HHM, cuya causa más frecuente es una infección persistente que afecta las paredes de los vasos sanguíneos. Y esta evaluación clínica dirigida la hemos simplificado en el test de HHM.
Hi, my name is Dr. Wes Ely, a physician at Vanderbilt University in Nashville, Tennessee, and I'm here just to share a few thoughts with you about long COVID and the road that we're on in terms of discovery and finding answers for people who are suffering. Here at our CIBS Center, which stands for CIBS, Critical Illness, Brain Dysfunction, and Survivorship, we try and engage with people who've suffered from an acute illness long after they were expected to have been recovered. We have support groups that meet every day of the week, and we've tried to create a community where people with long COVID and the spouses and family members of those with long COVID can find a place to share and scream and yell and cry and find hope and find healing during these weeks and months. And we're also doing some fairly, I hope, helpful research funded by the National Institute of Aging and National Institute of Health that's going to incorporate a randomized controlled trial to study immunomodulation as a potential treatment for long COVID symptoms. You know, long COVID is a disease state. It's a disease state whereby months after somebody suffered from acute COVID, the person goes on to have organ systems, one or multiple organ systems of the body not working. This can be profound cognitive impairment. Many of you listening have this entity, so I'm not here to tell you what it's about, but cognitive impairment, cardiovascular problems, Pott's disease, gastrointestinal problems, ME/CFS, Sjogren's, connective tissue disorders. The list goes on, and I'm so sorry for the way you're suffering. You are the experts of your own illness. You're teaching me every day what this is like, this IACC, this infection-associated chronic condition. And we want to be here as servants to help you find answers. We hope that this reverse LC or RVLC, reverse long COVID clinical trial of baricitinib, which is an FDA-approved drug for COVID, for acute COVID, and also for other diseases like rheumatoid arthritis and lupus. We're going to allow people who enroll into our study to be randomized in a double-blind fashion to receive 6 months of either baricitinib or placebo. This will be a very, hopefully, helpful way for us to understand how an immunomodulator might improve the long-term healing process of people with long COVID. This is obviously a devastating public health problem. We are here to try and help and be servants. I myself, Dr. Wes Ely, am the principal investigator of this RVLC trial and one of the co-directors and founders of the CIBS Center here in Nashville, Tennessee. Our website is icudelirium.org. We also are going to have a reverse LC website, but it's not launched yet. By the time you see this, it might be there, so try and look for that. And we hope that you found this interesting and helpful, and that we provide more and more healing and answers through our community and through our investigations as we go along in time. Thank you once again, and I'm sorry for your suffering.
Polybio is a nonprofit research organization created by two scientists who study the brain and infection. And what we do with our core team and now a growing group of people is we work with teams at different academic institutions, and we conceptualize and build collaborative projects to study root cause drivers of conditions initiated by infection like long COVID. We're doing quite a bit of long COVID research. We started a group called the Long COVID Research Consortium, which is a team of scientists at different academic institutions, actually in several different global locations right now, collaborating on long COVID. And some of the sites include, for example, teams at Harvard Med, at UCSF, at Yale, even the Karolinska Institute in Sweden. And what we're doing is we're sharing ideas, hypotheses, and in some cases, samples as often as possible to do work on patients with long COVID. That includes collecting and studying a wide range of sample types from patients, not just blood, but also a good number of tissue samples from patients like gut tissue or lymph node tissue. And our program also supports some pretty cool, innovative imaging methods so that we can better understand what's happening in patients' brains and bodies. Our consortium wrote a paper in the journal Nature Immunology that details evidence thus far showing that SARS-CoV-2 as a virus is capable of persistence in a wide range of brain and body sites, and in some cases has been found hundreds of days, if not in some cases a year after initial illness in patients with long COVID symptoms. And in that paper, we went on to describe how potentially reservoirs or persistent SARS-CoV-2 could impact a wide range or drive a range of other abnormalities also documented in long COVID patients. So for example, it could contribute to microbiome imbalances in patients. It could drive some of the clotting or other neuroimmune or nervous system problems that patients also have. So there's a lot of potential for continuing to follow what we consider to be a major consideration and growing body of evidence for in the space. The main factors that we're looking at are the straightforward possibility that patients simply just don't fully clear the virus after acute illness, and that a little bit of virus persist in their tissue as a reservoir where it's better protected from the immune response. So that could be a little bit of virus that remains in the lining of the gut or in the lining of the lung or in a different body site. And then that virus or persistent RNA or protein in that body site could drive immune abnormalities, genetic abnormalities, even potentially metabolic abnormalities. We also see that in some long COVID patients, infection with the SARS-CoV-2 virus appears to kick up, or does in some studies, kick up latent infections that the person already harbored. So all humans harbor a certain number of pathogens, for example, like Epstein-Barr virus, or in some cases, even some of the tick-borne or vector-borne pathogens that are usually can sometimes be in a dormant, latent, or just a state where they're not driving symptoms. But if a person gets COVID and that sinks their immune response, it could be an opportunity for those latent pathogens themselves to reactivate and potentially drive new sets of symptoms. So that's another trend we're looking at closely. If patients can continue to tell all key stakeholders, from the government to philanthropists to anyone really in the world with resources, that long COVID, SARS-CoV-2 related chronic consequences to even other conditions, cardiovascular disease, Alzheimer's disease, and even infections beyond SARS-CoV-2, how all of these topics need much more funding and a much more serious approach by government and even private stakeholders. That's huge. In other words, just keep getting long COVID and the vast range of SARS-CoV-2's chronic consequences on human chronic disease onto the radar of as many people who can make a difference as possible.